chose to do the overhead squat assessment because it highlights any major discrepancies within the system. The overhead squat assessment illustrates any compensation or impairment at checkpoints such as the feet, knees, lumbo-pelvic hip complex, or at the shoulders. So it pretty much demonstrates any discrepancies within our whole human movement system. So I performed the overhead squat assessment for 5 repetitions in the anterior, posterior, and lateral view. And then after, I watched the video to identify any discrepancies that I had. So what I discovered was that I had a slight forward lean. My feet turned out, specifically my left foot turned out slightly when I was squatting. But the major discrepancy that I identified was that my feet came off the ground slightly when I was squatting. So if this was the ground, my feet were not flat, my heels slightly raised as I squat. So that was the major discrepancy that I found. In the next video, I will discuss inhibitory techniques, lengthening, activation, and integration techniques that will hopefully help with my discrepancy, help improve my human movement patterns so it will not lead to a bigger problem down the road. This video is inhibitory techniques. Inhibitory techniques are beneficial to the human movement system as it decreases overactive tissue, helps reduce trigger point sensitivity, adhesions, pain, and inflammation. As discussed in the previous video, my discrepancy is that my heels raise off the ground. A common overactive muscle that helps promote that discrepancy is a overactive gastrosoleus complex. So in this video, I'll show an SMR technique of foam rolling to help reduce tension in those overactive muscles. And so what you want to do is you want to get your foam roller. I'm going to put my other leg over top to get a deeper tissue release. And so what you want to do is you want to relax your muscle, roll in small increments back and forth for about 30 to 90 seconds. And if you come across a sensitive area, you're going to pause on that area. And then again, small increments for 30 minutes. We'll discuss lengthening techniques. Lengthening techniques are beneficial to the human movement system as it elongates shortened muscles, increase flexibility, and range of motion at a tissue joint. Because my heels raise off the ground when I perform an overhead squat is an indicator that I have a limited or reduced dorsiflexion due to my overactive gastrocnemius and soleus complex. So in this video, I will perform a lengthening technique that will hopefully elongate those shortened muscles. So when I perform an overhead squat, my heels remain flat on the ground. And so what you want to do, I'm going to perform PNF calf stretch. And so I'm going to put the band around my foot, keeping my leg straight, and I'm going to do a passive stretch for 10 seconds, where it's not irresistible, where I feel a stretch. Then after 10 seconds, I'm going to pull further for around 6 seconds. I'm going to hold this. Then I'm going to relax, and I'm going to pull further back. And I should be able to increase the stretch because of autogenetic inhibition. And I hold this stretch for around 30 seconds. In this video, I'll be discussing activation techniques. Activation techniques are beneficial to the human movement system as it helps re-educate and strengthen the underactive muscles. When there's underactive and overactive muscles, there's something called muscle imbalances. Muscle imbalances can lead to human movement discrepancies and impaired movement patterns, which then can lead down the road to injury. And so my underactive muscle in this case is my anterior tibialis. So in this video, I'm going to show you an activation exercise that will help isolate the anterior tibialis as the prime mover and strengthen that underactive muscle to help avoid compensation between the underactive and overactive muscles. And so I'm going to demonstrate resisted dorsiband flexion. So what you want to do is you want to get a band tied around a solid object that won't move that much. And for 1 to 2 sets, 10 to 15 repetitions each, you want to pull your toes towards your head, keeping your legs straight, just moving your ankle. Perform this slow and controlled 10 to 15 repetitions. In this video, I'll be discussing integration techniques. Integration techniques are beneficial to the human movement system as it helps increase multiplanar neuromuscular control and coordination, decrease compensation due to muscle imbalances, and increases range of motion. Integration exercises can be incorporated into a workout plan to help correct those discrepancies. And so my underactive muscle that I want to improve and strengthen is the anterior tibialis. A common reason why my heels lift off the ground when I perform an overhead squat is I have a lack of dorsiflexion. So I'm going to perform a single leg squat, which will help me improve my range of motion when performing dorsiflexion action. And so I'm going to perform this exercise for 1 to 3 sets, 10 to 15 repetitions each. I'm using a chair. If you're strong enough, you can do it without a chair, but I need a chair to do this. And so what you want to do is slow and controlled. You want to do a single leg squat. And this will improve mobility and stability at the ankle. Slow and controlled. 10 to 15 repetitions, 1 to 3 sets. After performing the 4 continuums and analyzing the video, I did notice an acute improvement within my movement pattern. My heel did not come off the ground as nearly as much as it did in the previous video. Unfortunately, my heel still slightly came off the ground when I performed the overhead squat. I think with time and effort, practicing these 4 continuums, I will notice a huge improvement within my discrepancy, so I'll be continuing to do so. I also found by performing the 4 continuums, it helped make the overhead squat feel a little bit more natural and more comfortable. Thank you.